Just Connect TV, streaming live. Just Connect TV is your entertainment and educational channel. We broadcast authentic content that will inspire, empower, and stir up the potential and positive energy in you. Just Connect TV, streaming live. Get yourself a high-quality branded hoodie, t-shirt, caps, umbrellas, you name it, we got it. You order, we deliver. Just Connect. Ever felt the need to learn how to play a musical instrument or improve your music skill and never knew where to go? Just Connect School of Music is the place to be. We offer professional training in music sight reading, piano, drums, guitar, saxophone, bass guitar, and vocal training. We are located at Eprin Square, 3rd floor, room 26, opposite Buruburu Police Station. Just Connect, building worship. Just Connect TV, streaming live.
Hi, welcome to Just Connect Online TV. This is me and my health show. I'll be your host, Faith, and today I'm joined by
Jama Ngugi.
Karibu Sana.
Thank you so much.
So today we want us to know, why do we have this show?
First of all, I'd like to introduce myself. My name is Jama Ngugi, and I'm pleased to be hosted today. The reason we have this show is we desire to create awareness to the general public and our viewers, because there has been a need of various issues which we shall look at to create awareness first, to ensure that the patient, if anyone happens to be a patient, how do you express yourself before the medical practitioners? And what do you need to know about your health? Because we are talking about ourselves and our health. Because there is a difference between you as an individual and your health. So how do these two mingle together so that you are able to live a fulfilling life, one that is not interrupted by issues of medical cases that could have been avoided? So that is why we desire that these shows will be informative and engage our viewers so that they are able to avoid unnecessary cases, that they can enjoy their health fully.
So I believe what you're trying to say is we should not just diagnose ourselves and just sit at home.
Absolutely. Kwanza hiyo story ya kwenda tu pharmacy unabuy dawa without, because every drug that has been manufactured has got its own purpose. And we have trained personnel who are able to prescribe the right medication in the right dosage and for the right condition. But we realize that actually not every health issue requires a prescription of a drug, because sometimes unaweza fikiri uko na ugonjwa fulani only to realize that you are only tired, you needed to rest, but you've prescribed yourself drugs that will end up bringing an issue in your health system, and then they'll warrant for a doctor now to come in, and you may even spend a lot of resources that would have been avoided.
True.
So the reason we have this is to inform our viewers and their families for that matter, so that, because conditions are continuing to increase by the day, and once a person is educated and informed, they are able to make also informed choices. So in this show, we'll be inviting physicians who will be able to look at the general health, educate us on different conditions like hypertension, diabetes, other conditions probably that are inherited, or even infections that come our way. How do we avoid those kinds of things? So we'll also be able to have public health experts, people who are able to help us in preventive ways of managing our health so that we don't fall into sicknesses and conditions. Because you realize some of the diseases that or conditions people are going through are lifestyle in nature.
True.
So when our audience is well informed, they'll be able to live quality lives looking into the style, the way they live their lives, whatever they eat. Do they exercise? What is the level of exercising? Do they supplement their bodies and those kinds of things? So we'll have nutritional experts who will guide us with information so that we are not just dispensing half-baked information that ends up messing people's lives. Other areas that we'll also cover are specialists, because you realize that in the medical field, there is that element of the general practitioner who is able to address all the general diseases and probably the clinical features that a patient may exhibit. They're able to address those as first hand, but probably they require a specialist to address that issue, or we are looking into special parts of the body, say like our teeth. I don't know when was the last time you visited a dentist.
It's a routine checkup for me.
It's a routine.
Yes.
You are so lucky because some of us labda ni wakati tuling'olewa meno, and that was the last time we did our teeth.
Yeah.
So if we have a dentist in our show, we'll be able to know what is the space of time that we need to take in between a checkup, and what is the necessity of it. Ama nitaenda tu kwa dentist ile jino, like your gum is so inflamed and there's a lot of pain, and the only thing that can be done is to remove the tooth, and you can't salvage it because you would have avoided it, for example, if your teeth were regularly checked, but sababu you just went the last minute, it has to be removed. There are other issues like the issues of the eyes, not just wearing of specs, but there is the ophthalmology where there is an eye specialist, an eye doctor who is able to look at various diseases that are associated with the eye. They could be due to conditions, they could be due to infections or exposure to different kinds of rays or something. So we'll be able to bring those so that they can educate us more on this, so that you are not rushing again the last minute when your eyes have given you all the problems. Probably you had a diabetic condition. How often should you visit an ophthalmologist to check your eyes? Do we know all this? How often should you check your sugars, even if you don't have diabetes? How often should you check your blood pressure, even if you are not hypertensive? This is the information that we want to transmit to our viewers, so that it cannot just be good to their ears, but they are able to take action and be able to live quality, healthy lives.
Yeah, you've mentioned about the dentist, and mostly what we think, or normally what it is, when we have maybe some irritation in the tooth, one tooth, you hear someone, umetumia toothbrush kwa muda gani? You're supposed to change your toothbrush once in 3 months. I don't know how true is it, but yes, from experience, a checkup is really nice. It saves you a lot, because when once the damage is done and you're trying to recover, it takes a lot of time and resources, and especially I know health has become something that is very expensive to have.
Exactly.
And when you go to the doctor, you spend a lot of money on petty issues, yet we would have avoided hapo mbeleni.
Exactly.
So basically, to our viewers, what you're trying to say is not the mild headaches, but if they're recurrent or you have something that it has prolonged pain, do not treat yourself. Tunanunuanga Panadol kwa duka, nasema hii kichwa itaenda, nikikunywa kahawa itatulia. Yeah, we have very many myths, so yeah. I think
and there's also another aspect. I've seen it, and this is really close to my heart. When I'm walking in the streets, you'll find somebody has a particular gadget on the street, and they'll tell you that it's capable of telling you every disease in your body. And from the medical background that I have, having been because I'm a trained medical laboratory technologist, hakuna one particular equipment inaweza kupima ugonjwa zote, because all these systems that work in hospitals, they do different diagnoses. So hakuna moja ati utasijui ekelea kidole ama sijui ufanye nini ikwambie ugonjwa yako iko mahali fulani, and then you're able to, or you take this one drink and then you are complete. So what we want to do is, remember the Bible says that my people perish for lack of knowledge. And in line with scripture, we want to share information. There has also been an issue of misdiagnosis, probably necessitated by the way patients express themselves once they are before a clinician. not that the clinician initially had a problem, but because we don't know how to express ourselves. Labda umeenda hospitali unaulizwa shida yako ni nini? Mwili yangu inauma yote. Like, how do you expect the doctor now to take it up from there? Utafanyiwa test gani? You know, so these shows will help us to be able to even learn how to communicate with the medical professionals, as much as they're in a position to extract information from us.
Yeah.
But again, how do we express ourselves? You know, because people sometimes don't want to give their history. Unafanyaga kazi gani? You don't give true information. You just unafunikia tu vitu. And probably the way you live has a lot to do with the way you are feeling. So that would have guided probably a medical expert to deal with it. So once you get the information from the experts who will be coming on this show, you'll be able to know and understand what to say. You don't need to be medically educated to so that you're able to be, you know, a patient. But there's a lot of information that is available, even online. But we cannot again use the Google doctor to treat ourselves, because that is the other issue we are having in our society.
Actually, it's not only Google, but we've also resorted to traditional medicine. For example, there's I don't know, it's coal or is it charcoal, whichever it is. You're told your tooth is a bit dirty or browny in color. You scrub with it. You have an ear infection, you put what do we call it? Tunaitanga mafuta ya kuku. Unaambiwa itaponya. Ama unasikia koo inauma, unaambiwa kunywa maziwa ikiwa imechanganishwa na mayai ambayo hajaiva. Unakoroga, unakunywa. Yes, so I think some of us still practice traditional medicine. When it doesn't work, that is when you resort back to going to the medicine from our doctors. We consult our specialist. But you see, at times, I've seen some people using traditional. When it has flopped, it's too late for them to salvage or to get an alternative, because it has caused already harm in their bodies.
Exactly.
I don't know, is it something, will you advocate for traditional medicine, just as a by the way?
For me, I don't know, there are those general things. I would say that is close to first aid, and probably these are the issues, some of the issues that will be addressed in our shows. Because kabla ufike kwa daktari, you need to know how to arrest. For example, if you've cut yourself, how do you arrest the bleeding?
Yeah.
So some of these things people do are like first aid things. Traditional medicine is fine. Herbal medicine, they call it herbal medicine. But we need a specialist to tell us the amount of a particular healing element within that herb, the dosage of it, so that you don't overdose or underdose.
No.
So there are those people who will engage with that, which is not a problem. But again, you need a specialist to advise you. That is why we have this show. So if you resort to the alternative way of medication and not the conventional one, which is through hospitals and all this, you'll be able to get proper information. If, for example, you host a doctor or a medical expert who offers the alternative medicine through traditional way, taking herbs and all that, we will get to know how the dosage is administered, and our viewers will be able to engage with such a person and get more information about it, so that we are not doing it from an ignorant perspective or from a cultural perspective, because also culture has a lot to do with the way we handle our health. Yani, like, I don't know whether this is so stereotypical to say, but unapata women, not women, but women. Sisi wanaume. You'll go to hospital when you have a lot of pain. Like, before you go to hospital, it can take you 40 years for you to go to the hospital. Paka yani, probably you needed something to, just a simple checkup. Wende tu, tolewe damu kwa kidole, upimwe, iangaliwe kama uko na your sugars are high, or such a thing. A simple test. Or probably you had a medical camp close to you, ililetwa through your church or through a community or a hospital organized for that, but you didn't see any value to go. It was free. Ungepita tu hapo uangaliwe, but probably, maybe we fear to be told that we have particular conditions. That is why I'm saying culture has a lot to do with the way we look at health. And these are the issues we want to address by the specialists and the experts in these fields. That is why we are having these shows, so that people don't continue suffering. People are informed. What is your responsibility as an individual before you become a patient?
Yeah.
What is your responsibility? We need to know that as well, so that once you are before a health expert, you'll be able now to know how to converse, and you have an effective way of diagnosing or treating whichever condition one has. Kitambo nilikuwa nasikia mtu akisema my doctor, and I used to wonder, gosh, this one can afford to, yani anaweza afford kuwa na daktari wake personal, but I want to imagine that the concept is about, a physician who is able to, you have regular checks. Na si sababu wewe ni msick. I don't know, when was the last time we ulienda like a thorough checkup?
Thorough, it's been a while. We do not go for checkups until you have that campaign somewhere. So, yeah, let's say I have been to the doctor, but not for full body checkup, but for specific things. And this is because I have had a bit of challenges. Yes. But if you ask about my eyes, I do it yearly.
That is
annually,
good.
Rather.
And that is what is important, because some of the conditions, say like cancers, they are able to be arrested well before they become things that you cannot even manage. Like, it's recommended for women, I think, to have pap smears every 6 months, but we'll get that from our experts. I'm not the final authority. That one we can check. That is why we have this show. Once we bring in an expert, he'll be able to follow with us. There's something I wanted us to inform our audience about other issues that we'll be addressing on the importance of medical insurance. It has been really a challenge for us as a community to deal with the medical expenses. And thankfully for our government, the NHIF has come in handy to help a lot with managing this particular issue. You realize that you can spend a lot of money to deal with one family member who has a condition or who has been met by an unfortunate sickness which could have been acute or urgent. It was not actually something that was growing, an accident or something. But we'll have experts to tell us more about medical insurance, the importance of medical covers, so that the family does not lose their hard-earned cash that would have been saved through a medical scheme or a medical cover. But since you didn't have it, now you end up selling everything so that you are dealing with this. So that is part of what we'll be looking at.
Okay. I also believe, because of during this corona season, we've had a lot of mental illnesses. I believe that also will be addressed. I know it's a question of yours would want it to be addressed, even if not in too much detail, but at least to be able to prevent it and how to go about it. Also, I think even for the transition from from childhood to adulthood, there's like adolescent whereby people become psychological about it, because I am a young girl, 15 years of age, I do not have breasts as the others, I do not have, my body is not changing, my hips are not broadening up. It's also a challenge, and I believe it leads to also mental health, and people withdraw. Do you call it the withdrawal syndrome?
Yeah.
Yes. So I believe our viewers will be able to learn, even us ourselves. We do not know everything. We're all here to learn, and we're here to equip each other.
Exactly.
Yeah, I don't know any other thing you'll add on, because you've mentioned about dentist, eyes, cancer, added mental health. I believe that it's a very broad topic when we come to health. And also, as you said, health insurance is very, it's not a must, but it is a must, depending on how you value it. There are people who will tell you, for example, like men, you always will say, mimi si mgonjwa, itaisha tu, nikipaka hapa karobo nikisugua hivi inatulia. But we do not know tunasugua inaendelea, hiyo ugonjwa ama whatever is ailing inakulemea.
Exactly.
Yes.
Yeah. So we really have a lot to look at, and there is also another way that health can be addressed. Especially, you mentioned about the COVID issues that we've had, and initially also we had the HIV. And there are other ways that the medical professionals are able to advise about home-based care. So we'll have an opportunity to have these specialists come tell us on how these systems work, so that if the patient is not able to be treated from a hospital setting, then they can still get medical care while at home. So, but we'll understand these techniques and these specialities from the who's, the ones who know what it means and how it works. So you really cannot afford not to be part of this show and to always, clock in set time to be following us.
Yeah, tuache kujitibu na tuache kujifanya madaktari nyumbani. Kwa hiyo unajua unasema you have kids, so utasema mine had these symptoms, nikampatia hii ikafanya kazi. So you tell me or you tell your neighbor, mpatie paracetamol itatulia fever. Kidogo fever ishuke, kwa sababu sio fever peke yake, there's something else that is ailing. So keep it to Just Connect Live TV, and we'll be able to explain, expound. If you have questions, just comment on the comment section so that we can be able to address. And also, if you have something that you want to ask, we'll be able to give you feedback, because we want it to be an engagement. It's not only us saying and talking about it here, but we want even you, our viewers, to be able to be part of us. Even if you comment, we still get back to you. Yes.
So you can't afford to miss our invited guests who are professionals and who are vetted. So it's gonna be interesting and great. Thank you so much.
Karibu sana, and thank you for sitting on the hot seat today.
Yeah, true.
It's not easy, but we thank you, and I believe we'll keep it here for more. And it's not only about health, we have a program lineup. I believe you'll be able to see it, and also subscribe so that we can be able to know that you are helpful to your viewers. Thank you, and karibu sana. I've been your host, Faith.
Jama is my name. Thank you so much.
Just Connect TV, streaming live. Just Connect TV is your entertainment and educational channel. We broadcast authentic content that will inspire, empower, and stir up the potential and positive energy in you. Just Connect TV, streaming live. Get yourself a high-quality branded hoodie, t-shirt, cap, umbrellas, you name it, we got it. You order, we deliver. Just Connect.
Ale, salama. Dhambi zangu ziliniweka mbali na Mungu wangu. Oh Yesu, wewe ulikuja ukachukua kitambaa kanipanguza na damu yako. Sasa mimi nimesamehewa dhambi, mimi ni mwana wa Mungu. Damu hiyo imefuta jina langu kwa kitabu cha mauti na kuliandika kwenye kitabu cha uzima. Damu ya Yesu, 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 damu ya Yesu. Siyo damu ya ng'ombe inayoosha dhambi, wala damu ya mbuzi inayotakasa makosa, wala mafuta au mifupa ya nguruwe inayoweza kutoa mapepo. Ila ni damu ya Yesu peke yake. Ukitaja hiyo damu mapepo yanatoroka. Yesu, damu ya 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 Yesu, damu inayonena mambo mema zaidi ya damu ya Abeli. Nikitaja hiyo damu mimi niko salama. Nikitaja hiyo damu mimi nimepona. Hiyo damu ikiandika baraka kwangu nimebarikiwa. Hiyo damu inaponya magonjwa yote. Damu ya Yesu, 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 inayoponya magonjwa yote. Damu ya Yesu, inayonena ushindi wako. Damu ya Yesu, inayonena baraka zako. Damu ya Yesu, inayonena kuinuliwa kwako. Damu ya Yesu, inayonena mambo mema. Damu ya Yesu,
Ever felt the need to learn how to play a musical instrument or improve your music skill and never knew where to go? Just Connect School of Music is the place to be. We offer professional training in music sight reading, piano, drums, guitar, saxophone, bass guitar, and vocal training. We are located at Eprin Square, 3rd floor, room 26, opposite Buruburu Police Station. Just Connect, building worship. Just Connect TV, streaming live.